Hi, so today I would like to talk about observation of cognitive impairments. So what is a cognitive impairment? A cognitive impairment in a person is they might have problems in the ability to think, to make decisions, to remember, to use their judgment, and so on. Anything that has to do with everyday life of thinking. Cognitive impairments also mean memory loss, trouble concentrating, trouble completing tasks, trouble understanding, trouble following instructions, and also trouble solving problems. So what are the main causes of cognitive impairments? Well, the cognitive impairments are mostly caused by Alzheimer's disease, which is also found in elderly aged people these days. For example, I have a patient and I am pretending I'm the patient. So if I'm the patient, the doctor is gonna ask me where am I from, what's my date of birth, so on and so forth, anything personal. And me as a patient, I don't remember anything and I don't respond to the doctor. So that is when the doctor realizes that the patient can't remember, which also memory loss, which also can lead to a cognitive impairment. Now, the doctor might use this and ask me, the patient, to squeeze. And if I am able to squeeze, my motor skills are still functional and I can still take orders. But on the other hand, if the patient does not squeeze this and does not follow any order from the doctor at all, there's also another sign of cognitive impairment. Now, the next example could also be the doctor will stand around a 2-meter range from the patient, and the doctor will throw this at the patient. Normally, a person with no cognitive impairments can catch this like a normal person can, like what I did. But a person with cognitive impairments, they can't respond to it, or they are slow. So if I can catch this, okay, that is a motor impairment. I can't catch it properly, or I'm too slow, or I react faster than whatever happened. So sometimes cognitive impairment patients can also not reach things that they can see through their eyes. For example, this is here. I am the patient. I can clearly see it, but I can't reach it because of the impairments of my body. So a normal person could just grab it like this. That's all. So the few final steps are also giving a patient a piece of paper and asking the patient to draw a circle. Normally, the circle will not turn out to be a circle if the patient is cognitively impaired. So the circle will either be like scribbled or whatever. And also the doctor may ask simple questions like what is 2 plus 2, for example, or what is 1 plus 1. And if the patient hesitates or does not even answer those simple questions, that is when you know that your observation of the cognitive impairment patient is complete.